Artificial sweeteners can cause weight gain. Is this true or simply a myth to scare you? Let's find out in today's video. Artificial sweeteners weight gain. Impact of artificial sweetener on body weight. To begin, are artificial sweeteners safe? Sugar replacement purchases have increased as health-conscious consumers reduce their sugar intake. Diet beverages are the most common source of these sweeteners in the American diet. Sucralose, often known as Splenda, and aspartame, included in the ingredients of Diet Coke, Diet Pepsi, and thousands of other items, are two of the most popular artificial sweeteners. Stevia, a zero-calorie plant extract touted as natural, is also a commonly used sugar substitute. The selling point of artificial sweeteners is the claim to fulfill your sweet appetite without adding extra calories to your diet. However, whether they can be used to prevent weight gain has long been a question. Some studies are now providing solutions. Researchers suggest that artificial sweeteners can be helpful as a tool to assist people in kicking their sugar habit, and that replacing sugar with non-nutritive sweeteners can help some people avoid weight gain. How much weight loss are we actually expecting once the switch is done? Keep your fingers crossed. Additionally, artificial sweeteners can negatively affect hormones, blood sugar, and other parts of metabolism, which some specialists believe are problematic, and they warn against consuming them regularly. The misconception is that because they have no calories, they have no metabolic effects. Marta Yanina Pepino. Marta Yanina is an assistant professor in the Department of Food Science and Human Nutrition at the University of Illinois, Urbana-Champaign. According to her, the research indicates that artificial sweeteners are metabolically active, and depending on how frequently you use them, some people may experience more significant effects than others. Furthermore, she discovered in her research that obese adults got more insulin resistance after drinking a sucralose-containing beverage versus drinking merely water. Another clinical study found that sucralose use promoted insulin resistance, a precursor to diabetes, in adults of normal weight. That's not all. Artificial sweeteners also trick your brain, affecting other bodily functions. We will discuss that in a moment. However, don't forget to subscribe to this channel. It is an excellent way of telling us you love our content. Also, researchers at Boston Children's Hospital investigated what happened when soda consumers switched to water or artificially sweetened beverages in a recent paper that was published in the Journal of the American Heart Association. The study included 203 people who consumed at least one sugary drink daily. They were divided into 3 groups by the researchers. One group was given artificially sweetened beverages like Diet Coke and Diet Pepsi and advised to swap them for their regular soft drinks. Another group received plain and sparkling water supplies. A third group, acting as a control, consumed sugary beverages as usual. The researchers found no general differences in weight gain or other measures of metabolic health, such as changes in cholesterol or triglyceride levels, after tracking the groups for a year. However, when they focused primarily on those with significant levels of abdominal obesity, the results were startling. As we promised earlier, you can now uncross your fingers. People with the highest belly fat gained much less weight when they switched from sugary drinks to diet drinks or water. Those who used diet drinks gained around a pound, while those who switched to water lost about half a pound. People with a lot of abdominal fat who continued to drink sugary drinks acquired an average of 10 pounds at the end of the research. Another clinical trial led by researchers at the University of North Carolina at Chapel Hill discovered that obese adults who were instructed to substitute water or low-calorie sweetened beverages for sugary beverages for 6 months lost an average of 2 to 2.5% of their body weight. On the other hand, the group that switched to water had significant changes in their blood sugar levels, which is a risk factor for diabetes, whereas the group that used low-calorie sweeteners did not. Dr. David Ludwig, co-director of the New Balance Foundation Obesity Prevention Center at Boston Children's Hospital and a co-author of the study we discussed earlier, hypothesized that patients with a lot of belly fat could gain the most from substituting diet beverages or water for sugary drinks because they produce more insulin, a hormone that promotes fat storage, in reaction to sugar. A lean person may not be as sensitive to sugar, he explained. However, their study warned that there was a lack of evidence on the potential adverse effects of the sweeteners. Despite decades of widespread use, it is still uncertain whether long-term hemi consumption can have unforeseen negative health consequences. It is unknown why saccharin has such a strong influence on weight gain. However, non-nutritive sweeteners that are hundreds of times sweeter than sugar appear to do more than just activate taste receptors on the tongue. They can cause negative changes in the gut flora, alter blood sugar regulation, and impact insulin levels. Dr. Robert Lustig, an obesity expert and emeritus professor at the University of California, San Francisco, stated that artificial sweeteners confuse the body by sending signals to the brain and digestive system to brace for a rush of sugar. However, suppose those calories do not arrive. In that case, it can throw hormones like insulin out of sync, eventually leading to metabolic dysfunction. That is something you will not want to happen to you. To learn more about artificial sweeteners' effects on your body, we recommend you watch our video on our artificial sweeteners bad for you. The science behind sugar versus artificial sweetener. See you soon.